Hi everyone, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. In this video, we're going to be talking about what to consider before you begin sleep training. There's tons of great sleep content coming your way, so make sure you hit subscribe below so you don't miss it. Now, let's say you're a parent who's potentially on the fence about beginning sleep training. Speaking of fence, I'm pretty sure that the lawnmowers are out in full blow and our landscaping is going on. Please excuse any background noise. It is what it is. Anyways, so let's say you're a parent on the fence about potentially beginning sleep training and you're not sure. Well, we're going to address the most common concerns and pitfalls that I see as a pediatrician in my office. Now, when you're picking a routine, I recommend trying to stick with it. Now, there's a caveat here. You're not locked into a particular routine, but you gotta have a little bit of backbone that you don't give up the first time you try something new. So please know that one night of crying does not necessarily mean that you have to give up a certain method. Children are going to cry. I would say that 99.9% of sleep methods out there have a child crying at least a little bit. Crying is a baby's primary, really only mode of communication initially. So don't be alarmed if your child does cry. Don't throw the towel in and completely move on. You can absolutely move on to a different method if you find that it's not giving you too much success, but you'll never know if you give up very early on. So try to stick with it, try to get through that first nap, and then try that same method for the second nap, and try that same method for the third nap, and then try that same method overnight, and then try it for the second night. And again, what I say is try to give it about a week. And on that note, make sure you don't compare. This is so important because your friend might say they got through sleep training in a week, or maybe they did it in that fancy 3-day method. But here you are 2 weeks in and you're still struggling a little bit. You're finding some glimmers of success, but other days that are not so great. Well, guess what? That's normal. I'm here to tell you that as a parent of 2 who has sleep trained both her girls, there are some days that are much better than worse. In fact, you could probably hear my daughter right now crying. Our nanny's here. She's able to attend to her. I'm actually sitting on the floor of her nursery right now. She's still very young and sleeping in our room. So as you can see, it's more important to me to be able to be flexible and move around and keep her in her routine. Speaking of, make sure you have a solid routine. I've discussed this in another video, which I'll link right here, but having a routine is so important. I'm sure I sound like a broken record, but it's so important. Whether it's having a bath first, whether it's reading a book first, whether it's reading to sleep, or if you sing lullabies to sleep, whatever it is. Even if you rock your child to sleep a few minutes before you put them into the crib, try to do the same thing consistently while you're going through your sleep training methods, and make sure that you keep with consistent time spans as well. So one night the child should not be going to bed at 7 and the next night going to bed at 9:30. You really have to try to keep consistent sleep windows. That's very important when it comes to setting the background and the landscape for your sleep. And right now, my book, It's Time to Say Goodnight, is for sale at the link below in the show notes. If you purchase it and actually DM me the receipt on Instagram, you'll be entered for a free sleep consultation with me. If you're watching this video at a later date, please know that the sleep consultation is available before December 2021. So if you DM me the receipt afterward, thank you so much for buying the book, but the sleep consultation won't be available at that time. So let's say you've established your solid bedtime routine, but you're just not sure of what actual method of sleep training you want to go into. You've probably done lots of research online and think that you have picked the right method, or you're between 2 methods. I'll dissect and talk more about some of the sleep training methods out there in another video, but what I want you to know is some DIY sleep training methods are totally fine. You can absolutely pick and choose some of this method, some of that method. Just going back to whatever you stick with, make sure you're consistent. So for example, let's say you go with Ferber and you're not okay with going in at the intervals that they set and you want to create your own time intervals. That's totally fine. For me, I actually changed up some of the sleep training methods that I did with both of my daughters after a couple of weeks. Again, something that was successful at one time. As my daughter got older, I had to switch it up and change to something else. And that is totally okay. So DIY methods are just fine. You can pick and choose from different ones. And on that note, just know that it is okay to hold off on sleep training if you're not ready. I personally, as a pediatrician, felt very comfortable with choosing to sleep train both my girls when I did sleep train them, and I'll elaborate more in another video on how I chose to sleep train my daughters. But just know that if you're not ready, there's no reason why you absolutely need to. You might be told by your pediatrician or your mother-in-law or your best friends or your spouse that it's time to sleep train that child and you're just not ready. That's totally okay. Nobody is allowed to tell you that this is the time that you have to sleep train versus this is not the time. There might be certain times in a baby's life where it's a little easier than other times, but you're not absolutely locked into this time frame, 3 to 6 months or before the first year of life, where you absolutely must sleep train a child or that train is gone. But let's say you're still having trouble. My last important reminder is help is out there. Sleep consultants are an actual occupation that can be incredibly helpful for so many families. They provide knowledge, support, and an incredible resource when it comes to considering sleep training or just trying to get yourself back on the right track to get your child in a good sleep routine. I have patients and parents who've personally used sleep consultants or sleep consultant services and really benefited. Make sure you hit the subscribe button below for part 2 of things to consider before beginning sleep training. That's all for this video. I'll see you next week. Bye.